We're back in the kitchen for our monthly segment with a medical professional to show us how food and our body can be in perfect harmony. Today we have Dorothea Mies from OSU Center for Health Sciences, who's graduating in October as part of the first class of physician's assistants. Congratulations.
Thank you.
I mean, I know October's a long way to go, but how do you feel right now? Just you're in May, a few more months to go, and you're part of that first class.
It's very exciting, a little nerve-wracking being the first class, but I think our faculty and our program and just general OSU has set us up for success tremendously to come up on the future. It's coming up quicker than maybe I thought it was going to be. 6 months feels like a long time, but it's coming up quick.
If folks at home don't know, and maybe they've been to the doctor and they get to interact with a PA, what do you do as a PA and what do you want to do with your PA training?
So PAs, we are able to diagnose and treat and write prescriptions, and we're able to have like our own patient population. We will have a collaborating physician that is on our license and kind of right out of school be a little bit more of a supervisor role, but as we gain experience and get a little bit more advanced in our career, it becomes a little bit more of a collaborative approach between the two of us, just like it would be a healthcare team taking care of our patients, whether that's nurses, respiratory therapists, anything like that.
And what do you want to do? What area of medicine are you really interested in hoping to just jump into?
So I am kind of just starting my job search, being 6 months out, but I would really like to work in an inpatient setting, kind of more acute or critical care, maybe an ICU, something like that.
So I thought it was interesting as we get to the recipe here, this easy pasta salad. Dorothea, your undergrad kind of prepared you for the balance between nutrition and medicine, right?
Yes.
This is like perfect.
Yes, so I have a bachelor's degree from Kansas State in human nutrition, actually.
Great.
So I learned a lot about how food can also be medicine, as well as, you know, traditional medicine.
What do you love about this recipe? Kind of take me through it and what the ingredients are here.
So what I love about this recipe is that it has lots of veggies, lots of color to it, lots of different vitamins and minerals and kind of the micronutrients that we don't always think about. I chose a chickpea pasta as the base. Chickpea pasta is different from traditional pasta because traditional pasta is typically made with flour. Chickpea pasta is made with chickpea flour, kind of ground chickpeas, and it adds extra protein, which I found was very important. I'm always trying to get enough protein in my diet. And it's also gluten-free for those who maybe are gluten sensitive or something similar.
And this doesn't have meat in it either, which is another way to get protein, because folks who don't eat meat, you have to get protein somehow, some way, and chickpeas are a way to do that.
Chickpeas are a great way to do that. A great source of plant-based protein, absolutely.
Arugula is our green, and kind of how do we put it all together? If we're putting this together at home, kind of take me through it here.
So super simple. I just started by chopping up all of my vegetables. I've got some red onion, some cucumber, there's some parsley in there, some basil, as well as the arugula, and some tomatoes as well. And then I just cooked my pasta kind of by the box directions, and then you just toss it all together. You let the pasta cool, you toss it all together. There's a dressing on there. It is an olive oil based dressing, so it's olive oil, Dijon mustard, some lemon juice, and so it's great. It's light for when it's hot outside.
That's really good, and I'm noticing kind of lower sodium as well, as I think a lot of times we think, okay, to get the flavor, we've got to dump all the salt on there, we've got to get all the pepper, but you know, lower sodium, that's going to help us as well.
Right. Lower sodium is also very heart healthy.
Good. So arugula, I want to talk about that before we go, because this recipe is super simple. I mean, we're flying through it just like that. So arugula kind of has that peppery flavor if you've never had it, but kind of with the kale family, right? That nutrient-dense greens. Tell us the value of things like the arugula and the kale, as opposed to maybe like an iceberg lettuce.
Right. So I kind of like to use a good rule of thumb. The darker your greens, the more nutrient-dense they are. So they're going to be more dense in like vitamins and minerals that maybe iceberg lettuce wouldn't have. So iceberg lettuce is going to be made up of mostly water, whereas our dark leafy greens are going to be more dense in nutrients and micronutrients and vitamins.
Very good. Dorothea Meese, congratulations on your upcoming graduation. I hope the family's watching online from Kansas today. Thank you so much.
Thank you.
Coming up, we are taking you back in time to a pop-up museum featuring Tulsa's early years as the oil capital of the world. We'll be right back.